dissecting addiction. So one thing I find useful is an iceberg model. And here's how this works. People come in for help or counseling, and you ask, okay, what are you here for? Well, I have a problem. Okay, when you're doing your problem, what are you doing? Well, for me, I drink. Then we're going to ask two questions. What people, places, circumstances, events, times of day, locations, people would make you want to drink? Or what do you think it would be like if for whatever reason you could not drink? And that's going to take me down here. Let me come back up to triggers for a moment. So one way to think of a trigger, here's when I get out of bed, here's when I go to sleep, and here's my day. And here's when I drink or drug. A trigger is anything that's going on right before I do, and I do, and then I have rewards and consequences. So I used this example before. Say, for me, anxiety is my trigger. So it's rising, 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 rising. I take a drink or a drug. Reward, it drops from a 9 to a 5. I can handle a 5. I can't handle a 9. Consequence, DUI. How do you feel in those moments? What do you do with those emotions? I drink. So whether I'm rewarded or I run into a consequence, sometimes both of them bring me back. I've seen a lot of times with gamblers, they will have a trigger and gamble. Jackpot, $10,000. A non-addict would say, see ya, I'm out. I am done. An addict is like, wait a second, I'm just warming up here. Can't you see what this is? This is my night. And the rest of us would be, I'm out. So reward brings them back. Consequence, they lost their shirt for the 10th time. Oh my gosh, I can't leave that on the table. I gotta go win that back. So whether they're winning or losing, I'm on the hamster wheel. And so an interesting aside, I learned this from one of the clients who did some research while they were in treatment. And they found this expert in Britain. His name is Dr. David Nutt, N-U-T-T. And they modified an MRI machine so that you could gamble in the MRI machine. And so they put somebody in there and they could talk to him and they said, okay, you can gamble. And he started gambling, and it didn't matter whether he was winning or losing, his brain did the same thing. So the point is, it's the behavior a lot of times, and that changes the brain, and that's what becomes addictive. So does this make sense, the difference between triggers, rewards, and consequences? Okay. So common triggers I hear: stress, ABC store, party, whether it's at the office or other, holidays, being alone. So what do we do with all this? Remember we mentioned replacement, that I have to replace the function of my addiction? We have to build a bridge from the old way of coping to a new way of coping. So every healthy functioning adult somewhere somehow picks up coping skills or strategies. And these don't make my problems go away, but they bring them down to manageable levels. You know, if I'm having a hard time at work, I reach in my tool bag and I have some coping skills. If I have issues with people at home, I reach into my skill bag. If I'm having a rough day, I reach into my skill bag. And some triggers you can get rid of. If I drive by the ABC store every day to and from work, maybe I need to take an alternate route for a while until I am strong enough to not pass it. Maybe I have to remove myself from parties and work within my limits for a while. We can't avoid these, These are part of life. Stress is part of life. Being alone happens. We got to balance that. So some of these I can get rid of, some of them I can't, but I can learn a new way to deal with them. Any questions on that? This stuff is often referred to as what keeps you awake at night, or where you really hurt. Examples for a lot of folks with addiction: feelings of shame, there's something wrong with me; fear. And it is important what I'm afraid of, but it's equally as important what I do when I'm afraid. It might have to do with my past. It might have to do with rejection. It might have to do with abandonment. So a lot of times people can only observe what's above the water, and you might get comments, just stop drinking, just stop drugging, knock it off. Can't you see how simple this is? And if you only see this, you might be under the impression that if we just arrest the behavior, we're good to go. But that's a Band-Aid. So what we have to do in sequence is arrest the behavior and replace it with coping skills. And in the same way that it's taken a while to ingrain whatever my addictive behavior is, it's going to take a little while, namely practice, to get these really ingrained so that they become habitual and they're effective. So we build a bridge to a new way of coping, find out what triggers are punching my buttons, eliminate the ones that I can, and the ones that I can't, learn new coping skills to take care of those. These issues are often best dealt with in individual therapy. I am a big proponent of groups, and I think they're great, but I think most people will probably only go so far with really personal issues in a group setting. There might be a few courageous people that will really get dead honest, but I think most people are more prone to open up and get vulnerable and really deal with those things in individual therapy. So, again, you can't fight what you don't understand. So, the definition we used in the last hour, an attempt to meet legitimate needs. I bet everybody in the room has felt these at some point in your life. And the problem is, this kind of works temporarily. So, this is usually what's driving the behavior. But family members, friends, people that don't know much about addiction, they just, for understandable reasons, they're focused on the obvious because this is so visible. Sometimes that's not. Sometimes this is, sometimes it's not, and so forth. You can't tell if people right off the bat have abandonment issues in the first 5-10 minutes, the first 5 or 10 meetings. It might take longer than that. These are not readily visible, but they're really powerful. So arrest the behaviors, replace them with skills, eliminate the triggers I can, acquire skills to handle the triggers that I can't remove and that are just part of everyday life, and work toward resolving these. This is abstinence. This is recovery. I've put my puzzle together and I've come to understand here's why I drink or why I drug. And if I'm going to be whole, I gotta resolve this so that I'm okay with it. Any questions on that? Comments? I've had people ask before, do you always have to have issues down here? No. I've met some people that don't. They just get caught up in the physiological, impact of the drug or alcohol, and they do have triggers. But I would say the vast majority of people do have underlying issues.